Okay, welcome to Lecture 3, where we're going to look at the directional terminology, which we had already started on. So here we're going to look at the terms that indicate direction. We will just consider anterior, posterior, of course. So to start with anterior, now when we talk of anterior, how do you define anterior? How do you define it? So when you talk of anterior, talk about towards the front part of the body, near the frontal surface. Okay, for example, when you talk of the sternum, that's the breastbone, is normally located in the front of the heart. Therefore, it is anterior to the heart. Okay, then we can give an analogy. Imagine you facing forward and anything you see in the mirror. So whatever you see in the mirror, what lies in the mirror is on the anterior side. So that's the anterior. And then we can also talk of posterior, which is also referred to as dorsal. So how to define it is that posterior is toward the back of the body or near the back surface, of course. So the spine is posterior to the sternum, just like the way sternum is anterior to the spine. So the spine is posterior to the sternum. Think of a backpack. Okay, it normally rests on the posterior side. Have you ever seen somebody placing a backpack in front? Of course you can, but now in most cases it normally lies posteriorly. Okay, yeah. Now let's look at medial and lateral. Now when we talk of medial, it's towards the middle line of the body. Imaginary line dividing the body into right and left half. Example, the nose is medial to the eyes. Okay, it's located to the middle part. Then picture of a line running straight down the middle of your body. Structure closer to the line are medial. So most of the structure that are closer to the middle line that lies along your body, where we have the sagittal plane, I mean. So when you're moving towards that line, you're moving medially. When you're moving away from that line, we say you're moving laterally. So lateral can therefore define as away from the middle line because of the body to other sides. Example, the ears are lateral to the eyes. Look at where the eyes is located and look at where the ears are located. So the ears are lateral to the eyes. Think of a lateral as moving outward from the center line, extending your arms away from your body. Okay? Yeah. So when you talk of proximal and distal, so when you talk of proximal, it's closer to the point of attachment of the limb to the trunk or the origin of structure. Example, an elbow is proximal to the wrist. Look at my wrist. And we have the elbow. So it's attached to the wrist. Think of the shoulder as home of the base structure. So any structure that is found away from the home base of the shoulder, we refer to it as being proximal. Then we talk of distal, meaning farther from the point of attachment. You're moving far away. Okay, so the fingers are distal to the elbow. They are far from the elbow. So imagine traveling down your arm as you move away from the shoulder towards the hand. You move distally, of course. You move distally. So in summary, we have at the middle line, when you're moving to the left or you're moving to the right, you're moving laterally. When you're moving to the midline or from either right or from either left but to the middle line, then you're moving medially. When you're moving downwards, you're moving distally. Okay. When you're moving upwards, you're moving proximally. Okay. Then we have the anterior part, which is the ventral part. Then we have the posterior part, which is the dorsal part. Okay. And so on and so on. We also have superior, which is upwards, inferior, which is also downwards. Okay. Yeah, got it. Otherwise, thank you for today's lecture. That's what we have for today. So